Good morning. Good morning, everyone. With me today is County Supervisor and co-chair of the county's COVID-19 subcommittee, Supervisor Nathan Fletcher, City Councilmember and chair of the Regional Task Force on Homeless, Councilmember Chris Ward, Tamera Kohler, who's CEO of the Regional Task Force on the Homeless, President and CEO of the Convention Center where we're at this morning, Rippetoe, and of course Bob McElroy, who is President and CEO of Alpha Project, one of the city's great homeless service providers. Last Monday, as I'm sure many of you know, we announced a new regional approach to help protect homeless individuals from COVID-19. We set some pretty ambitious goals. They included completely reorienting our shelter system to create adequate distance between people and establishing 2 new spaces to shelter homeless individuals. In the 9 days since, we've been making good on these commitments. Last Tuesday, staff transitioned dozens of homeless families to motel rooms. By Wednesday, nearly 100 individuals from our existing bridge shelters started moving into the lower level of Golden Hall. And now, this morning, we are fulfilling that next phase of the commitment. Starting today, the help that homeless individuals need during this COVID-19 emergency can be found inside these iconic walls of the San Diego Convention Center. The Convention Center is a welcoming beacon for people from around the world. And during this pandemic, it will be a beacon of hope for our community. This Convention Center space will help us spread out our shelter beds, be more efficient with staffing, and protect parts of the population that are most susceptible to the coronavirus. This effort will maximize resources among more than a dozen government agencies, nonprofit providers, and key stakeholders that help with homeless services. It will offer the same services as our other shelters, including 24-hour security, meals, showers, restrooms, laundry services, ADA accessibility, Wi-Fi access, and most importantly, health screenings. Health screenings to ensure that folks are healthy and do not pose a risk to themselves or others out in the community. I want to take a moment to thank my colleagues at the County of San Diego. We continue to work very, very closely with the county to screen and to monitor individuals. And any individual who is exhibiting symptoms who is at a greater risk of exposure or part of a vulnerable population will continue to be placed in motel rooms per the guidance of county health officials. Now let me be clear, the Convention Center will be more than just a temporary shelter. It will be a pathway to permanent housing. We're calling this Operation Shelter to Home. Not only are we going to secure their health, we're going to secure individuals' housing. That is the whole goal of this effort. And everyone who walks through these doors will be connected with our regional service providers. These professionals will work to locate family, apartments, or other options to help end the cycle of homelessness for as many people as we can. Launching an operation like this takes time and deliberate planning. So we are going to be following a phased approach to ensure folks receive the utmost care upon their arrival. Today, this morning, we are starting to move people in from the city's 2 bridge shelters that are operated by the Alpha Project. As folks continue to get situated at the Convention Center, we will move to our next group and so on. Once we have moved in the entire population from all of the bridge shelters, we will look at capacity for bringing in unsheltered men and women from the streets of San Diego. And this is key because fighting the coronavirus requires an adequate rest, good hygiene, and a healthy diet, and maintaining physical health. So if you're living on the streets in a canyon or a riverbed, that's next to impossible to meet those goals. Slowing the spread means getting people in a clean and safe environment with adequate physical distancing, a place like we can offer now at the Convention Center. We want to scale up to at least 1,500 individuals here. As someone is moved into a permanent home, their bed will open up for a new person. We will do this as many times as possible until this emergency is behind us, with the goal of ultimately reducing the number of people experiencing homelessness in San Diego. And before I turn it over to Supervisor Fletcher, I want to take a quick look at the big picture. The fact that tourism has virtually stopped throughout the world is obvious, and certainly less than ideal, as an understatement, for San Diego's economy. But the actions we're taking today, I think, are a silver lining. San Diego now has access to a huge facility that can shelter many, many more people more efficiently than ever before. We have a chance to make a significant and fundamental change to homelessness in San Diego. This is an opportunity to tackle the coronavirus and the homeless crisis at the same time. We can't fill our convention center with tourists, and we're going to make sure it is filled with hope, with progress, and with San Diegans who can put it to good use. So I want us all to remember that we are not passive participants in this pandemic. Each of us has the ability to make choices that can change lives, that can save lives, whether it be physical distancing, or whether it be staying at home, or whether it is using every asset at our disposal to keep people safe. So I would like to thank the San Diego's tourism industry, including the Convention Center President and CEO Rippetoe, for stepping up, really stepping up in this time of need. I'd also like to thank the Metropolitan Transit System and the City Parks and Recreation staff for helping to transport people and their belongings today. And again, I want to thank the county, including Chairman Greg Cox and Supervisor Nathan Fletcher, for their partnership, and everybody at the County of San Diego. Now it's my pleasure to introduce someone who is, as I mentioned, continued to be a fantastic partner in this, County Supervisor Nathan Fletcher. Supervisor?
Thank you, Mayor Faulconer. I think that San Diegans should take comfort in a couple things. One of those things is that in a period of crisis, we have all of our jurisdictions working together, talking together, collaborating, and moving forward together in one direction. That includes not only our city and our county, that includes our city and our county and the other cities throughout the region. That includes our partners like the Regional Task Force on Homeless, our transit agencies like MTS, our private sector partners like our hotels and motel industry, our tourism industry, our civic, philanthropy, government, nonprofit sectors are all in daily coordination, and we are moving forward to confront what is an unprecedented challenge. And it is an incredible thing to see and to witness and to watch, and it's something that is not happening in every region of the country or even in every region of the state. And I think that all of the leaders involved in all of those sectors to be commended. There has not been a single instance or a single time where we've reached out for someone where the answer has been anything other than, yes, let's do it. And that's why I think you see things that traditionally take years to get done are getting done in a matter of weeks. Things that traditionally take months to get done are getting done in a matter of days. Things that traditionally take days are getting done in a matter of minutes, because we know that our ability to flatten the curve, to raise the bar, to ensure the integrity of our healthcare system is dependent upon our ability to move swiftly. And I am so grateful for everyone who is here, and in particular, thank you to the mayor, Regional Task Force on Homelessness, Councilmember Chris Ward, and of course our convention center for today's significant step forward in ensuring that we are protecting vulnerable populations and protecting the entire population. On any given day, this convention center is an incredible asset that showcases the latest in innovation or entertainment or automobile or whatever convention may be in town. And starting today, this convention center will showcase the latest in humanity, in compassion, in public health. It is a tremendous testament to what the community of San Diego is doing and coming together to provide all of the resources that individuals may need, starting with public health screenings. If they're sick, we're going to get them into healthcare, either via a public health motel or via our healthcare system. If they are vulnerable, we're going to get them in an appropriate setting via one of the Regional Task Force on Homeless motel rooms that will keep them isolated, fed, cared for, daily wellness checks. But beyond that, as they come into this facility, they will be physically distanced to protect them from the spread of coronavirus. But the county will also be here on hand providing mental and behavioral health services, signing them up for available treatment programs that may get their life back on track. It's not only protecting the public health, it's protecting their health and putting them on a pathway to a more sustainable recovery. There are a lot of individuals who are unsheltered on the streets today that with the proper level of service and engagement may have a family or a friend or someone who might be willing to take them back in. There may be opportunities in this to begin to connect them back to those permanent housing and those permanent steps that we can take. And so I really view the efforts at the Convention Center as the anchor of truly a regional approach to ensure that the homeless are not only protected from coronavirus, but that we can begin to put them on a path to good physical health, good mental health, and a better overall well-being in place. And so I'm pleased to have the county both as a participant in contribution of money to help fund this operation in phase one, but also as a dedication and commitment that we will have county staff on site to sign up individuals, to treat individuals, to get them connected to the services that are available in hopes that we can all come together and do this. And so my eternal thanks to the Convention Center for making this resource available to the city, to the Regional Task Force on Homeless, to each of our homeless providers who do this work, this hard work every single day, that have continued the hard work of caring for these individuals who are our friends and our neighbors and fellow San Diegans. They care for them every day. They do it in an increased way during a period of crisis, and we're incredibly grateful for all of them. So today is a really good day to kickstart and get moving, and we look forward to continuing to move forward with all of the efforts that we're taking in every different sector of San Diego to put us as a region in the strongest position to come through this well. Thank you.
Thank you, Supervisor. Next up, as mentioned, Councilmember Chris Ward, who is part of the Regional Task Force for Homelessness and Chair. And Chris, again, thank you for all of your help and support that has allowed us to really work together as a team.
Great. Well, thank you, Mayor Faulconer. It's my pleasure, both as the chair of our Regional Task Force on the Homeless and the council member for downtown San Diego, to really applaud the actions that we're doing here today. The use of the Convention Center for additional shelter beds advances some of the bold actions that we are taking to protect all San Diegans during COVID-19. As Californians are ordered sheltered in place, safely distanced from others, there are thousands of San Diegans that don't have that luxury. By providing shelter at the Convention Center, we are building on the strategy to utilize all available resources and maximize spaces to be able to ensure health and safety for those experiencing homelessness. After last week's announcement to provide additional shelter space, we immediately began placing homeless families and seniors in hotel rooms and expanding capacity at Golden Hall. This has provided appropriate social distancing requirements and kept many of our most vulnerable safe. But keeping San Diego safe means keeping all San Diegans safe. By providing more unsheltered San Diegans the basic protections from this virus, we can contain the spread and we will save lives. Opening the Convention Center and transforming our existing shelter network for this crisis is a perfect example of how we must use everything in our control to meet this challenge. I want to thank Rip and the Convention Center staff here so much for stepping up at this time. I also want to thank Tamera Kohler and her team at the Regional Task Force on the Homeless, as well as Rick Gentry, Lisa Jones, and others from the San Diego Housing Commission that have been working nonstop on these efforts in the past few weeks. From our hospital workers to our frontline homeless provider staff and everyone that is simply staying indoors, San Diego is responding to this public health crisis, and we won't stop until all San Diegans are safe. Thank you.
Thank you, Chris. Next up, to talk about this new approach and how it will work is Tamera Kohler, who is CEO of the Regional Task Force on the Homeless. And just wanted to reiterate, as Tamera will remember, it was just about 10 days ago that this was an idea. And to be here from that idea to opening this facility, I think speaks volumes about the group of individuals that really jumped in, who care about San Diego so much. Tamera?
Thank you, Mayor, and good morning. As the Mayor said, it has been a marathon of people behind the scenes to take this from an idea and a commitment to be able to open it today. I have been in this work a long time. And I have never seen the power of coordination and collaboration and people coming together on a singular effort like I have around the convention center. And I want to highlight the importance of this unprecedented time. It is also unprecedented in our homeless crisis response system. Individuals experiencing homelessness in San Diego are more susceptible to the serious complications of COVID-19 than the population at large. Since the beginning of the COVID-19 crisis, the Regional Task Force on the Homeless has been leading and working with our stakeholders from throughout the San Diego region. We have worked to prepare our service providers with the information that they need for their staff and their clients to prevent the spread of a disease among our most vulnerable. All of the actions that we are taking are in consultation with our partners at the County Public Health and to ensure that we are following all recommended guidelines. As we did last week to get individuals into Golden Hall, we will begin moving people from the Alpha Project Bridge shelters into the Convention Center today and others in the coming days. These actions support many of our main objectives. Those were to consolidate our resources, including our public health resources, for screening people in our shelters, to create the necessary physical distancing amongst our shelter residents, which will now be essential to preventing the spread of COVID-19, and to add the capacity for more people to get off the streets. As the mayor mentioned, this project is being called Operation Shelter to Home, and that is of critical importance. Because working with the Housing Commission, we have devised a number of strong and intentional exit strategies that under typical circumstances would not be possible. We will have a team of case managers and housing navigators working every single day in this facility to find the right permanent home and free up more spaces to bring another individual into this facility. Some of those strategies include utilizing regulatory waivers to create more room sharing opportunities. And we are getting the support of the mayor and our county partners in making sure that we ask for those appropriate waivers. Prioritizing those benefits such as Social Security income and disability income. Leveraging flexible spending pool funds and increasing master leasing to transition households with subsidies. And enhancing the already successful family reunification program to reunite individuals with families and friends. While the city of San Diego has the largest concentration of homeless individuals, this is a regional effort. The RTFH has been working with our providers in the North, the South, and East County, as well as here in the city of San Diego, to ensure that all individuals are served, to ensure that all of our shelters have social distancing, and that they have the resources that they need, which are very limited, and they are challenged to meet the resource needs that they have. Serving those individuals that are most vulnerable may be through our motel rooms and other solutions. Yesterday, the county announced the unfortunate reality that 3 of our unsheltered San Diegans have tested positive. And we know there will be more. That's why we need the shelter, and we have all of our partners working together across the region to help our homeless neighbors. We are rebuilding our homeless crisis response system to address the unprecedented circumstances we're experiencing because of COVID-19. Our commitment is to be intentional, collaborative, and communicative, and to go together through these circumstances as a team, united to address the needs in San Diego. I want to thank each of our partners here, and I specifically want to thank those behind the scenes who have not taken a day off since we pitched this idea. Not only those at the Regional Task Force, but at the city and the county. There's a huge army of people behind making this a reality, and I want to personally thank them. Thank you.
Thank you, Tamara. We couldn't be here if it wasn't for the quick work of the Convention Center. The guy who's leading that effort, Rippetoe. Rip, thank you for your, not just your support, but the can-do spirit that said, how do we make it happen, and how do we make it happen quickly? Come on.
Thank you, Mayor. Thank you, Mayor. Good morning, everyone. It's our pleasure to be here first to be able to serve, but also to be able to say thank you to so many different organizations for the leadership from our mayor and our council members to supervisors and social workers, medical personnel, task force on the homeless. We're very grateful to them for all of the activity and the actions that they've taken in setting those decisions, those difficult decisions in place. It's a great example and it's a great team to be a part of. And with today's announcement and standing here actually in front of what we consider to be the famous Hall H, as many of you know from big summer activities like Comic-Con International and others, it's only appropriate that we continue to serve. And when we serve your convention center to you, the whole community. For us, all means all. And for the last 30 plus years, we've spent all of our time working on ways that we can create economic impact by bringing tourists and conventions and events into the community, supporting thousands of jobs that are in the hospitality industry and others, from retail and attractions and restaurants. And so we understand the gravity and the importance of this, but in light of the continued COVID-19 spread and the urgent need for sheltering within our community, we're glad to be part of the solution here within the county and within our region. And during the past week, as we have begun setting up cots and as we've been working with our team members and with the civic leaders to be able to install temporary showers and doing all of the things that we need to do, I'm struck by the enormity of the example that we're helping to set. We are an industry leader all over the country. And as that, I see many of our peer groups copying what we do or trying to emulate what we do. And so I'm proud to be part of a venue industry that's stepping up all over the world to be able to try and find ways to assist a community. We are people in our industry who believe we have the expertise to bring people together in meaningful ways. We can't think of any more meaningful way to do that than to be able to be a part of this shelter and to be able to help serve those who are some of our most vulnerable community. That means our unsheltered. And so I'm glad that we can use this community asset to serve our neighbors in need. I often remark that we build or help facilitate the building with our shows and our contractors a small city every week for the most important week of that organization's life, and then we tear it down and build another one the next week and the week after and the week after. This time we're pivoting all of that knowledge into building a shelter for one of the most important eras of our community's life. And this shelter operation is so important to what we all are doing. When the time's right, we'll go back to hosting conventions and trade shows and doing that economic impact. But we're committed to lending our operational expertise to this urgent, large-scale effort. I'm so impressed with our team and the way that they have responded so quickly in the past week. So I want to say thank you to all of our team members who are working so hard to do this. And on a personal and professional note, I'm grateful that our team here is so enthusiastic and so passionate about serving our community. It's who we are, it's our culture, and we're grateful that we can do just a little piece to help move this forward. So again, thank you to all of our leaders. I want to say thank you to our council, our mayor, Supervisor Fletcher, and all the supervisors at the county, our assembly members, of course the state. Thank you all for the support that you continue to give as we move forward with this endeavor. Thank you.
Thank you, Rip. Next up, it's my pleasure to welcome Bob McElroy, President and CEO of the Alpha Project, who is, of course, one of San Diego's fantastic homeless service providers, and is always a leader. Somebody had to be first to move in today. Bob McElroy and Alpha stepped up and said, it'll be us, we'll do it, and that's what leadership is all about. Bob, thank you for your tireless help and support. I invite you to say a few words.
I'm a little tuckered out. Thanks, Kevin, and certainly Nathan. You know, Mayor, County Supervisor, been a long day, sorry. But I consider these guys my friends. You know, whenever you need anything, they're just a phone call away. I pick up the phone. I know you regret giving me your cell phone numbers years ago. but you know, it gives me, I don't feel like we're out here doing this on our own. You guys are always there for us to provide the resources and information that we need. Your teams are outstanding. I want to give a shout out to Lisa Jones of the Housing Commission, outstanding. Keeley, I mean, all the way down the pecking order here. Just people have stepped up. This is not an easy thing to do. But we've been through this exercise of Fort Alpha Project. You know, we evac'd everybody when we had a flood one time out to the Qualcomm Stadium. Just to Rip, your team at the house, at the convention center, what a great groups of folks over here. Nathan on your staff over here has just been so kind to us and receptive to what we're trying to do. All of your team, all of your staff here that have been moving stuff around. I cause havoc wherever I go, moving beds around and changing some of the dynamics, but it's all working out. We're actually starting to move people now. I have to give a shout out to my fantastic staff. We've got over 100 men and women that work at both shelters. They've been there every single day. 100% of our staff has shown up every single day. Many of which of those folks, the men and women, have actually been homeless themselves. They know what it's like to be disenfranchised, and they show up every single day and make sure that our residents receive the services that they need. And our residents, I've been crying all morning just because when I walk in, they're always asking me how I'm doing, because I'm the old guy. And they're so happy that we're taking care of them, that we're all moving together. We're not a shelter, we're a community. And their biggest concern is that we were all moving together, all of our staff and people that we have relationships with. You know, those are moms and dads, brothers and sisters, grandmas and grandpas. They're far tougher and smarter than I could ever possibly be. And they're gonna make this thing work. Just like every time we do something like this, we're gonna make it work. We're gonna get settled in here. And our folks are all saying, as we did at the 17th Bridge Shelter 2, our greatest advocates for having people that are out there right now that are resistant to services, they go out and they become social workers, and they advocate to the folks out there that may not think they want to do this, to have them bring them in. So as I said, we've done it before. We'll do it again. And what a tremendous blessing that everybody here, all your staffs, Kevin and Nathan, the convention center staffs, the RTF, the regional task force, everybody coming together. I've never seen this kind of coordination, cooperation in my 3.5 decades. And it's going to be a tremendous blessing for all of us. And by the grace of God, we'll all still stay healthy, and we'll make it through this. Amen.
Thank you, Bob. Thank you for your words of encouragement to all of the team members that are here. And I will just conclude with a few remarks and add again to all the folks that are here and those that are inside. We know how hard everybody's been working this last week. On behalf of a grateful city and county and region, thank you. Your work, your tireless work, is really setting the bar. And most importantly, you're going to help people, and you're going to help people starting today. I want to thank the entire Incident Command team, the San Diego Housing Commission, Regional Task Force on the Homelessness, our San Diego Fire Rescue Department, who's been a big part of this effort, all of our men and women of the San Diego Police Department, County of San Diego, and their Health and Human Services Department, who's been extremely active. Of course, our Convention Center team, and everybody else, all of our service providers. It's been remarkable, it's been professional, and I want to thank everybody for rising to the occasion, and a lot of work ahead of us in the coming days and the coming weeks with one goal: how do we get people off the street, and then how do we get people out of the convention center and placed into permanent supportive housing. With that, this will conclude our remarks. I'm happy to answer any questions from any members of the media, or we can do any one-on-ones, and I believe there will be a tour for some folks as well. Yes,
Mr. Mayor, thank you. I do have a follow-up question. So the structure seems to be terrific, especially after 10 days. What isn't structured are the homeless that are on the streets right now. So with all due respect to what you're doing here, if this is going to run through the homeless on the streets, how? Yeah. I mean, that's the fly in the ointment.
And that's the next phase of this, Ed, and you hit the nail on the head. This is going to be extremely helpful for our existing shelters and social distancing. The next portion, that gets us to about 800. As I said, the goal is we're going to be able to ramp this up to 1,500. and that's with our outreach teams going out, to your point exactly, to those individuals that are still on the street to say, we have a place for you. We have a safe, secure place for you. So we're talking about some folks earlier. Some of the folks that are homeless have lost some of their support networks on the street. They want the opportunity to really get this safe and secure environment. And so that's why, again, this new system that Tamera talks about with such excitement is going to be built to have that capacity, not just for our bridge shelters, but increasingly for folks on the street.
Okay, I apologize because I was hoping to get a little bit of the phasing, but are you going to try to put more homeless teams together and especially have a mental health counselor there?
Yes.
Because you haven't been able to convince, with all due respect to what you've already done, other cities are looking at our example, and yet we've still got thousands on the streets who have not taken advantage of the shelters. Are you going to try to proactively put more people on there to try to convince them they've got to come here?
We are, and in fact, that's already happening. And again, can't say enough about the partnership, not only with our foot teams that are out there, but also with our county health professionals that are also out as part of those teams. Because the education component is incredibly important. And that word travels fast about how deadly this virus is. And so being able to not only have the health screenings out on the street, which we have, but now increasingly that says, and there is a place for you to go today, tonight.
All right, if I may, and I'll keep this briefer. Can you give us a little more of a schedule for the so-called phases? You've got the 2 bridge shelters now that Bob's running.
Yep.
So would the 3rd bridge shelter be the Veterans Village? And then are we talking about Golden Hall coming here as well?
I'll have Tamera, who's spent a lot of work on our phasing. Come on up. Thanks, Tamera.
You're welcome. A really important question. Golden Hall is not scheduled to transition into the convention center. Golden Hall was set up for social distancing. Our next one, I believe, is from it's been a long, as Bob said, we've been doing this, from Father Joe's Village and then VVSD. That may change in order, but that is our intent. We really need to, as Bob said, it's important to bring these communities over in a cohort, get them settled, then bring the next one over. So it's super important that we do this in a healthy and compassionate way, but that is our intent. And when you ask how quickly we can do it, we're going to see what it looks like today, how it sits with the residents today. Let's remember this is about people and the staff. And then we will move as quickly as we can that meets those 2 objectives. It meets their health and wellness. It works with the providers, and then we will pivot to our next phase.
Any other questions? Gary?
Yeah, good morning, Gary Worth, San Diego.
Good morning, Gary.
Yeah, also a follow-up question just on the phasing. So is phase 1, the 750 beds, all for shelter, and then it moves into the unsheltered? And what's the timeline for getting to the goal of 1,500? What are the shelters also, I was wondering.
Can you speak up just a little, Gary?
I'm sorry. What are the shelters that are going to come? It's besides Veterans Village and Father Joe's you mentioned. Is the Father Joe's the PMC? And are there other shelters besides that? And how many of the unsheltered do you hope to get? I was particularly wondering about the outreach that's happening with the unsheltered, because just driving down 17th and 16th Street, it's obvious they're not adhering to social distancing in front of God's extended hands. People are crowded together. They're shoulder to shoulder, waiting to get in or for a meal there. So I was just wondering about that effort to try to, promote social distancing from those folks, and how soon those folks may be getting inside this building.
So I'm going to try and, Gary, and summarize that, if that's okay. And you shake your head if I'm right. So the question was, how many other shelters are we actually, addressing this with? And then how are we getting the message out to those on the street that are unsheltered, especially around the social distancing? And I would also add the importance of using our hand washing stations, the hand sanitizers that we're putting out on the street to really work on that, and not touching their face. That's an important message that we need to remember, that those all go together. So the social distancing is important, but also that as much as they can, that they're using the numerous hand washing stations, and the importance of not touching your face. We need to reiterate that. And our outreach teams are out sharing that information, but it is many times for a unsheltered population, there's safety in being close to each other. So the importance of us really looking at our shelters and doing that social distancing, and then as we move to that next phase, being able to bring in those most vulnerable from the streets to also help them in a social distancing environment with the public healthcare as a foundation. I think one of the biggest challenges that we have, Gary, is we are seeing a loss of staffing across the entire industry, not just in homeless services, but also in a number of our other industries as well. So as we have used the convention center to do the social distancing, we are also serving our partners at the rescue mission, at PATH, all of our shelters across the region. We have reached out to all of them, even those that receive no funding from our organization but are a part of our system of care, to make sure that they're also practicing that social distancing. So that importance of phasing, we have individuals in Golden Hall that came from PATH and came from the rescue mission. So there's an intentional support that is happening across the entire region as well. And then the importance, I think, as we get to a second phase, that our outreach teams are engaging with our unsheltered population to not only tell them how to do this well on the street, but also when there is the opportunity here and a bed, that they can come and seek those services as well. And I believe, as the mayor said, as people are losing resources on the street, as the city begins to shut down, a homeless population that has been able to survive on the street has limited resources. And the intentional way that this has been set up in the convention center, I think many of our unsheltered will want to be served here, because they will be served well around a public health crisis of COVID-19, to get the health screening specifically, and to be able to get the meals and the supports and really orient them to housing as well. Thanks, Gary.
Time for one more question, and then we'll invite members of the media to go in and see the facility.
So obviously we're here in downtown San Diego. There are a lot of homeless people that stay in downtown San Diego and live in the shelters around here, but you have described this as a regional approach or regional resource. What is the plan for people that may be, in North County or maybe in the beach areas? And what is the plan to potentially transport and assess and triage individuals from around the county as well as on our downtown streets?
Yeah, no, Lisa, it is a regional effort, and obviously the work that's happening here in the urban center of the county is incredibly important, because we're the region, obviously, that is most impacted by individuals experiencing homelessness. The regional efforts, not only with the hotel rooms that I can't say enough, the county has stepped up on leadership. That is going to tremendously help, not just in San Diego, but it's helping in North County, it's helping in South County. And the public health nurse aspect of this, also not only here on site, but on site in some of the foot teams and others, I think is a great example of this is not just the city of San Diego, this is a regional effort. And that's how we will ultimately measure our success, is by saying we have to focus on all parts of the county. And that's why I think this effort has been so important.
I also want to get a breakdown from you all on the staff working here. Like, for example, could city staff or others from the county be pitching in? And also, how much are you expecting to spend, and what are the funding sources that you're looking at for this project?
Yeah, we'll get you a breakdown on all of that. Thank you for asking. This is a partnership. This is a partnership of city dollars, county dollars, regional task force dollars, or HAP dollars that we've all put in. And I think that was the key to the success in setting this up, which is everybody is going to help. Everybody understands not just the need, but the immediate need. And to break down, as a region, we've done so much better in terms of not having some silos, but they still existed. And so when you come back in a week from now and to see everybody who's on site here taking this to the next level, to look at every single individual, whether you're a veteran, whether you're eligible for HUD funding, what is it that prevents you from getting that permanent place today? That is the type of energy that is going to be surrounding this effort. And that's why you see people that work so hard, and not only to help people right now, but really to say, how do we create the model that gets you out into a place of your own as quickly as possible? And if there's a barrier to doing that, what is that barrier? And how do we fix that? What do we change for that? And so those are all of the conversations that we're having, not just here on the local level, but particularly back in Washington, D.C., as we've been on the phone with the VA, with HUD, to looking at how do we streamline things, because San Diego has the spirit, San Diego has the willingness, San Diego has the collaboration to actually make this happen. And I'm confident that we can be a model for other parts of the country.
So one thing that I am hearing a lot about as well, and I did ask you about this before the press conference, but I'll invite others to weigh in as well, is there is a lot of concern about, what would be the method of getting folks in, and, people are seeing that there's continued police enforcement. We know that there has been CDC guidance suggesting that unless there's a housing unit for a person to go into and potentially practice social distancing, that really camps shouldn't be broken up. How will people potentially be getting in here? Could there be police enforcement used as a tool?
Well, look, and our neighborhood policing team continues to work and do an outstanding job and continuing to say there's a spot for you. And increasingly that message is going to be the convention center. We do not have some of the large scale encampments that you see in other places in other cities, but we know we still have a huge need for people on the street. And so that's why this is so important, not only to help, as I said, with that social distancing, but that network of support that is oftentimes not existing right now because of the entire economy shutting down, bars, restaurants, et cetera. And so this becomes an absolute essential piece of the puzzle that did not exist for people before. And so this is going to work with our outreach teams, with our neighborhood policing division, but really with that incentive that says there is a place for you to go to get help, to get that shower, to get that help and support. And why, I also can't stress this enough, why having our behavioral health doctors here? Because we know that from our own bridge shelters, those folks experiencing either mental health issues or substance abuse issues are about 45% of the population. To have those services here, to help people get that support and then to get them out of the convention center into a place of their own is not only the goal, but that, again, I think will be the measure by how successful we're going to be able to do this. With that, we will pause. Thank you all for being here. And, we do have one text question. I'm sorry.
We have a few text questions. This one may be best answered by the county from the public health perspective.
Okay.
The question comes from KPBS. The Army Corps of Engineers has said that convention centers are ideal for building a lot of bed space quickly, and specifically in respect to hospitals. Have you been approached to use the convention center for beds for hospital patients or COVID suspected patients?
Yeah, we have two requests in to the state of California, one of which is moving down the pathway, and that's for a 250 bed mobile field hospital unit. It's important to note that this is just the stuff, right? In a hospital setting, you need the structure, you need the stuff, you need the staff. This would just be the stuff. So we're working with our health partners and our Reserve Medical Corps for how we would staff it. And Army Corps of Engineers is assessing multiple sites. When we get further guidance from them, we will share that guidance. But that would be a regional asset. Regardless of where it is placed, it would be 250 beds of hospital capacity that would serve the entire region. And so when we have more information to share on possible locations, we will share that. We have made a second request to the state of California for a 25-bed hospital unit. This comes not only with the stuff, but with the staff as well. And so as we get further clarification on if we will get that or not, then we will go through a similar process of the most appropriate place to site that as well. And as we have more information on where that may be, we will share that as well.
The next question comes from NBC7, hoping to turn in some questions to you for the press conference. How long does the city anticipate the convention center to be open to house the region's homeless? Are people's temperatures going to be monitored daily? Also, when they come into the facility to help stop the spread?
Yes, this will be open as long as it takes to get through this effort. And again, that's why having this full support of the convention center and everybody for this facility is going to be so incredibly important. The health screenings, temperatures, and others performed, again, why we did this in tandem with the county and our public health professionals is because not only is this going to be a safe and clean environment, it has to be a healthy environment. And so taking every precaution, every screening will be a daily fact of life inside the convention center.
This next question comes from KPBS. Will pets be allowed inside the convention center? And the second question is the San Diego Police Department still writing tickets to homeless people for encroachment?
Go ahead. The pets, I'll do the others.
So yes, the intent is when people have a companion pet that they can come into the convention center. We may end up having some that are kenneled, but many of these are companion animals and are appropriate to join them.
Thank you. As I mentioned earlier, our neighborhood policing division is still out there, still doing a remarkable job ensuring everybody's health and safety. And again, their focus is going to continue to be this facility is available. And we want folks to use it. With that, we will break, and thank you all again for coming, and we'll be available to take any of the media in for a tour at this point. Thank you.